Good morning. Now that we've worked out our technical issues here about actually Mac users trying to figure out how to work with the PC, I'd like to move on to our topic this morning, and very much appreciate your coming to our panel discussion. What I'd like to do is introduce our panelists here and then invite everyone to give a very brief presentation. We have hopefully interesting topics for you this morning, and then open it up for a discussion at the end of that. So hopefully we will have about 10 minutes of a presentation from very different perspectives on women's health and the environment. So it's my pleasure to introduce my colleagues here. Dr. Stephanie Kaza is a professor in the Rubenstein School of Environment and Natural Resources at the University of Vermont. Importantly, she co-founded the Environmental Council at UVM and is the director of the UVM Sustainability Faculty Fellows Program. She is widely known, certainly not only through the campus, but very, very broadly known for her values-based courses, which include women, health, and the environment. Her research emphasis has focused and draws on ecofeminism, environmental justice, consumer values, food systems, and transportation planning. Dr. Janet Gray is a professor of psychology and director of science, technology, and society at Vassar College. Her research focus is in the behavioral neurosciences, with an emphasis on the mechanisms by which estrogens, mixed estrogens, and anti-estrogens such as tamoxifen affect neural cellular activity. But she has become increasingly interested in learning and teaching about the intersection of basically the environment and women's health issues. And so currently she is the director of the Vassar College Environmental Risks and Breast Cancer Project. And then I'll introduce myself. I am the most technical of the group, and I wanted to provide some opportunities to explore what some of the laboratory-based, research-based findings might be on environmental toxins and endocrine disruptors. I'm Frances Carr. I'm a professor in the Department of Pharmacology in the College of Medicine at UVM, and my research interest has been on understanding the molecular mechanisms by which thyroid hormones act, both in development and also for tumorigenesis. And I've been particularly interested in looking at the impacts at the molecular level of factors such as BPA, pesticides like dioxins, and a variety of other environmental toxins. And I'm a member of the National Institutes of Health, Environmental Health Sciences BPA working group. So BPA is kind of a big topic. So we'll start at one end of the spectrum, if you will, and I welcome Dr. Stephanie Kaza to introduce us and to begin the conversation.
Okay. All right. Forgot my glasses. So let me tell you a story to start with. I'm a teacher, and a lot of what we do is telling stories to each other, and these have big impacts. And in this particular class that I have done the most work in, this Women, Health, and Environment, it's often almost all women, and they're almost all, 20, 19, 21. So it's a time of their lives which is full of emotion and concern and a lot of stories. One of my students in the last time I taught the class is Anna Taddeo. And Anna, during the time of the class, lost an aunt to breast cancer. And it was a very moving thing because when I asked the class how many other people also have relatives, or particularly close relatives, or friends of the family with breast cancer, almost every hand in the class went up. That was like 20, 25 people. So I knew that she was not alone, but I also knew that she was really struggling and suffering with this. So she became one of my poster children, so to speak, one of my adopted granddaughters, to take through the class. And she went on to study and do a senior thesis with me. And she was so concerned about the environmental factors that might be influencing cancer and highly motivated because of losing a beloved aunt that she did her senior thesis on introducing a bill to the Vermont legislature to ban one of these endocrine disrupting chemicals. Now, she didn't know very much at all about going to the legislature or who you talk to, but I hooked her up with two of the younger women legislators, and they took her to the committees, and she listened and went to Montpelier every week and carried the motivation from the class forward. So these are the kind of people that I work with in this topic area. So I'm going to tell you how we do it because, as you know, and as I'm deeply honored to acknowledge, this is a treat for me to be here, this is difficult territory. And when you're young, you don't have vocabulary to work with it. It's a roller coaster. But as a teacher, I think that's where the learning edges are, that you need to go right to where a student is the most concerned and the most engaged. And for a young woman, it's her body, and in particular, her reproductive health. So in this course, we start with a good amount of science so we can stay a little bit objective. But I precede that with reading Rachel Carson's Silent Spring. Of all things, the classic. But we talk about Rachel Carson as a person and her struggle with breast cancer and her story that she carried to the public about these different chemicals. And we look at where are those chemicals today that she was raising issue with, which have been banned, which are still in circulation, which may be now inside your own body. So it becomes a very personal book for them. And it is a very poetic book, and remarkably, many of the things Rachel Carson talked about have some scientific basis even today, and she certainly had a broad ecological worldview. But then after starting in that comfortable place as a student, you know how to study, learn things, take them up on an exam. I know that's just the beginning place. And their very first assignment is to find someone in your family, often it's a woman, but not necessarily, who you think might have an environmentally related disease or illness or cancer. And even if you're not sure about the evidence, get their story. Ask them to tell you their story. So I'm asking the students to learn how to listen and learn how to hear other people's stories besides their own, which they're fairly wrapped up in at that age, and then to write about it. And what they do is to learn to tell the story both from an internal perspective and an external. What is this person saying to me? So that's the first assignment. Then after doing a little bit of science, they read a novel together. Now this seems a little bit odd in the middle of a class, but the point of this novel, it's called My Year of Meats, and I highly recommend it, a great writer, Ruth Ozeki, is to work in small learning groups and let some of the emotions bubble up. And this book is nothing but intersections of women's issues, women's reproductive health issues, environmental issues, abortion questions, raising cattle with DES, and the impacts of all these different chemicals, but told in a very funny way and sometimes a terribly tragic way. So they will come into class just with, oh my God, did you just read that last chapter? What happened? So they're able to talk much, much more intimately. And that's what I want. And I go around and listen in, and now they're telling their stories to each other. They might share their story around an abortion as or the same as in the story. Now, of course, at this point, it would be very mean of me as a professor if I left them in the stew of emotions and the kind of, here we are again, environmental issues, and what can we do about it? They complain in my program about this all the time, environmental studies, because of course, we don't really have a very safe environmental world for them right now. So this is the perfect time to breed activists, okay? They're very upset. They're galvanized. They've built a learning community. I've been kind of holding them together as a group and talking and keeping them very engaged with each other. And then we read a book called Not Just a Pretty Face. And that book is about the cosmetics campaign and trying to safe cosmetics. And this has been going for a while. It's one of the most effective activist campaigns, and it's perfect for young women. One of the tools that was developed by the Environmental Working Group is a database called Skin Deep, which some of you may know about. And they it's a vast compendium of the most, well, maybe all, but a large number of cosmetic products, shampoos, sunscreens, face cleansers, eyebrow pencil, mascara. And so the assignment is go look up your products and see how safe they are. And they are rated for carcinogens, for hazardous chemicals, etc. And they see very quickly that some of the things they're using that they thought were pretty safe aren't as safe as they thought. So we have a best and worst products day. This is always very entertaining. Bring in your favorite thing that looks really groovy and green that you feel very virtuous about, and bring in your horrible thing that you actually really love and kind of don't want to give up. So it's a kind of support group for the trials and tribulations of facing chemicals in your life. So now they're really galvanized, and they take up an activist project that they have to do on campus, and I focus it on cosmetics and personal products. We don't have to worry about food. There are many other topics we could take up, but they all use soap and lotion and shampoo, and so do all their friends. So we have then produced videos and poster campaigns and chalking and focus on men and focus on younger women and going into high schools, and it's been terrifically satisfying. And so part of what I'm telling you is that the learning curve around reproductive health for this age is going through a dark tunnel and then coming out through the other side of being really empowered. It's a classic empowerment journey. I don't tell them quite all that, but I know that that's how I've designed the class. Now, they're not quite to the end of it yet because, of course, there's exams and other stuff like that, but they're open book. They can study together. It's still a bit community building. But the last response written assignment, it goes back to the story carrying. And now they have to look more at their own response to the material and what their stories have been, and they have to write 2 letters. And one letter is to an older woman, their mother, their grandmother, an aunt, somebody that they think would like to hear what their experience has been. They're not supposed to teach them anything. Don't tell them about, BPA and phthalates, but tell them what it means to you to have been in this class and what you've learned and how you feel about the issues facing young women today. Because many of these women now question whether they're going to be able to have a family. They don't know if their reproductive health and fertility have been damaged or will be by the time they want to conceive. They're pretty insecure about this, and for good reason. So they write to an older person, and this is as much as anything to imagine that there's someone there with more wisdom that cares about you, that has been on the journey in a different way for themselves. And then they write to a younger person, a younger sister, a cousin, somebody that's 10 or 12, and they act like the wisdom carrier themselves and say, now you probably didn't know this, but actually that nail polish that you're crazy about, those 500 bottles of different shades, could we try a different brand that might not be giving off toxins? You're right now in your developmental phases that are the most important. 12, 13, 14 is really a critical window when you're most susceptible to environmental toxins. So in the end, my job is to step completely out of the way as the teacher and see that my students are talking to the generations above and below them, and they just fledge off on their own. So let me end with where Anna Taddeo is today. She graduated a year ago with honors for her bill. It didn't actually get to the legislature because that takes about 2 years, and of course she was a senior and had to graduate. But she went on to teach for a program that takes students to China and Vietnam and Southeast Asia. That's what she's doing this whole year. And she's carrying this amazing feminist message and looking at chemicals all around the world with them. And she's coming back to go to Vermont Law School or another law school, wherever she's accepted, starting next fall, to carry this kind of environmental policy making forward. So here's the kind of story that keeps me going as a professor. Thank you.
Great. So hi, I'm Janet Gray, and I'm here from Vassar College, but I'm also on the board and a member of sort of the science team of the Breast Cancer Fund, where the Campaign for Safe Cosmetics is housed. It is a great coalition, and so thank you for the introduction. And if anyone is interested, I have a sheet with some a few websites, including the campaign's website and a new iPhone app, and I think it's also good for Androids, called Think Dirty, that you can take into stores and actually use to identify, and then also the Skin Deep site that Stephanie mentioned. So I love this first talk because it is clear that it is important for our young people to be learning about science and to be learning about advocacy and to be trying to understand their bodies and the ways in which environmental factors are perhaps putting us all at higher risk for a number of diseases, including breast cancer. And so what I really want to talk about in the next few minutes are some of the controversies about why we're having such a hard time in this country, both regulating and understanding the links between scientific evidence and disease. And it's not that the science isn't there, but there are loads of controversies in the science, and there are loads of controversies on the Hill and in the state legislatures as people try to make a difference to protect citizens of this country from being exposed to chemicals. So we all know that there are a number of factors that influence our risk for diseases, including breast cancer, including genes, lifestyle factors, a number of diet, exercise, alcohol intake. The kinds of factors that are most commonly talked about include endocrine factors like the age of menarche, age of menopause, timing of pregnancy, whether or not you breastfeed. And all of these have, as one unifying factor, the lifetime exposure to estrogens, especially estradiol, our natural estrogen. But increasingly, we understand that there are other hormones that are also important. The main important point here is that we know that breast cancer is a disease that, at least in large part, is affected by a number of different endocrine factors. But we also know that those sort of traditional factors, that is genes, lifestyle, and reproductive history, if we look at how much information that provides for us, it may account for about 50% of the risk for a disease like breast cancer. So there's a whole lot that we still don't know about. And increasingly, the scientific literature is indicating that there are a number of factors in our environment, including radiation, known carcinogens like benzene and toluene and TCE, compounds that are used by dry cleaners, industry, diesel offput, are associated with increased risk of breast cancer. But what I really want to talk about today is this class of chemicals to which Fran alluded before, that is endocrine disrupting chemicals. They are the chemicals that are getting the most attention, certainly in the scientific world and also in the legislative world. And as their name suggests, these are chemicals that are, they disrupt our natural hormone or our natural endocrine system. And I want to say, even though I'm going to be focusing on what we call EDCs, and in particular using BPA, Bisphenol A, as the example, that I do not want to suggest that if you drink out of a single sports bottle, you're going to get breast cancer. We're talking about the accumulation, as you'll see, over a lifetime, multiple exposures in a lot of ways, and that many of these chemicals, when they do exert effects, they are in interaction with our genetic makeup, our lifestyle, our hormonal lives. And so it's a really very complicated story that we can't go into in too much detail right now. But what I want to convince you is that we should at least be concerned or interested about these environmental chemicals. They're chemicals that are found in our bodies. They're found in adult bodies. So the CDC measures in what are called biomonitoring studies, our urine, our blood. And we know that these chemicals are found in, depending on what we're looking at, 80, 90, 95% of adults. They're also found, and this is of great concern, in amniotic fluid, in cord blood, in newborns, and in breast milk. So it's not just we in our habits as teenagers and adults who are going out and exploring the world who are being exposed, but our very youngest children and, in fact, fetuses are developing bathed in an environment in which these chemicals exist. So what? That doesn't necessarily mean they're bad just because, we're exposed to them. I'd like to step back for a minute and talk about BPA as an example for why we should be concerned and what some of these controversies are around this chemical. So BPA was actually first synthesized in the 1890s, and it was shown to be estrogenic in 1938 by a chemist who was looking for an estrogen that could be taken by women to help them prevent miscarriages and other complications of reproductive health. It was supplanted by DES, diethylstilbestrol, which, as many of you know, is a chemical that turned out to be disastrous for the millions of women who took it, in increases in a very rare vaginal cancer and then later increased risk for breast cancer. And now we know their daughters and even their granddaughters are also at increased risk for breast cancer. But despite knowing that BPA was estrogenic for a good 20 years prior to this, in the 1950s, it began to be used as the backbone for polycarbonate plastics and for epoxy resins that line most of our food cans. Now, in the 1950s, the major model for thinking about how dangerous a chemical was very different from what it is right now. But I just want to make clear this is a chemical that we should be concerned about. It's found in about 95% of adults and also found in loads of other fluids. And okay, hold on. I am not a, okay. What have I done? Slide, wait a minute, let me see if I push, there we go. Yes, okay, so what are the kind of studies that have been done that allow me to say something like BPA is a chemical of concern? So there have been, over the last especially 5 or 10 years, a number of clinical studies. So these are studies that have been done in humans, the first 3 in adults, the later ones in developing children as a result of either prenatal or early life exposures. So high doses of BPA have been associated with multiple miscarriages, sexual dysfunction, sperm damage in men, cardiac disease, and then early life developmental exposures associated with diabetes and metabolic disorders, lung dysfunction and respiratory dysfunction, oxidative stress and inflammatory responses, and increased aggression and hyperactivity in toddler-age girls. There's quite an array of problems associated with this chemical, not uncommon for exposures to endocrine disrupting chemicals. And I'm going to have to do this. I don't know why. Sorry. Next. Okay. Here we go. I really apologize here. Okay. There we go. So importantly, I'm happy to talk about this afterwards. There are a lot of problems, a lot of issues with doing human clinical studies on a chemical that's found in 95% of our bodies. It's very difficult to do real epidemiological studies. So many of the studies are done either in cell culture or in laboratory animal studies. And in laboratory animal studies, these are mainly rodent studies, but also some primate studies. Note that exposures to BPA are associated with exactly the same sorts of things that we find in the clinical studies: reproductive tract abnormalities, diabetes, metabolic, altered immune, altered respiratory, disruption of brain development, increased aggressiveness, and altered play behavior. And in rodents especially, we do have the ability to study long-term effects of early exposures in tightly controlled kinds of studies. And in those studies, we see that there are increases in both prostate cancer and breast cancer. And this is just one slide from a study by Acevedo et al. In 2013. These are rats that were exposed to very low levels, environmentally relevant levels of BPA prenatally, neonatally. And you can see in the top slide, or top part of the slide, for animals who were around the age of puberty, we see going from left to right in different animals the development of both pre-neoplastic and neoplastic lesions. This is in mammary tissue in rats. And then in the lower part of the slide, the presence of lesions or tumors in animals, again, who were exposed to very low levels prenatally, neonatally, as they went past puberty and into early and later adulthood. Let's see if I can do this. Okay. I am like, okay. So given that we have all these data from human clinical studies and also from animal studies, one question is, why isn't, I'm not going to even try to go back, why isn't BPA either regulated or banned? And in the short term, the answer is because BPA, even though it's an endocrine disrupting chemical, is treated as if it were a normal, and you'll see what I mean, normal carcinogenic, toxic chemical by the kinds of definitions we had in the 1950s and 1960s, that our regulatory system and in large part our science system is not prepared to deal with a complex type of chemical like the endocrine disruptors. So looking at some of the regulatory issues, in 1957, polycarbonate was first made from BPA. The first time there was any attempt to think about regulatory approaches to chemicals in our environment was really in 1958 in the Food, Drug, and Cosmetic Act, where the de minimis standard was set. And essentially what this is saying is that we worry about chemicals in this linear fashion. It's the more chemical, the worse it is. Okay, or the dose equals the poison, and if it's a carcinogenic chemical, then we try to figure out at what point do we no longer have to worry about some sort of response, and then that dose is figured out, and it's usually figured out in some human epidemiological studies, but also in animal studies, and then we take a considerably lower dose, usually 1,000th of the amount that has been shown to cause a toxic effect, and say that is the safe level. Okay, and that is the standard by which we in the United States determine doses to which we all can be exposed. Okay, this is going to drive me crazy. There we go. It's just slow, and I'm impatient. So in 1977, recognizing that BPA was being used really extensively, and there had been no real tests of BPA's health and safety. It had been grandfathered in by the so-called Toxic Substances Chemical Act, TSCA, in 1976, never tested, along with 80,000 other chemicals. The EPA and other regulatory agencies decided they should actually test BPA. And so the first BPA test was done using the traditional carcinogenic test, so looking at adults, high doses for 2 years. And in its wisdom, the federal government hired Lytton Biotech, which actually 2 years before they had found to be one of the most fraudulent companies in terms of federal testing, but that's a whole other story. In 1982, finally, the NTP, which is our regulatory agency in Washington, found, quote, no convincing evidence of carcinogenicity. Now, mind you, there are only two categories by which they could determine either there was evidence of carcinogenicity or there wasn't. And using this kind of model of straight linearity of high dose, no effects were found. So in 1988, EPA set the first regulatory standard based on BPA being a carcinogen and using these criteria, even though it was known for 40 years that, 45 years that BPA was estrogenic. Okay, here we go. So fast forward a little bit, in 1993, scientists figured out that BPA was leaking from plastic. It actually was found first in a laboratory study that got messed up because the polycarbonate flask was used, and lo and behold, estrogenic material was leaching from the flask, and it was determined to be BPA. And in the 20 years since then, we've learned a lot about BPA as an endocrine disruptor. And importantly, we've learned that BPA and other endocrine disruptors act like hormones, and that means they work at entirely different doses, tiny, tiny doses. They are more effective at early times of development, prenatal, early life for compounds like BPA that affect the estrogen system, at puberty, at the time of breast development, like during pregnancy. And so there are time-dependent times Low doses are really important, and they work via this non-monotonic curve, not linear. And so just for 1 second, what do I mean? I'm going to be patient. It is going to work. It's not going to work. Here we go. Okay, so there are loads of different ways that chemicals could work besides a linear. And just to look at the one in the red curve here, it could be that there's sort of a linear relationship, high doses, low doses. But then look, very, very low doses actually exert stronger effects. And many of the endocrine disruptors do have these kind of non-monotonic or unusual by standard regulatory system expectations. So we have a chemical that exerts its effects early in life that is very finicky. Okay. So in the last 15 years, early in life at very low doses in a non-monotonic way. In the last 15 years, despite the growth of all this scientific evidence, there has been no change at all in the regulatory standard. There is still the primacy of industry studies over academic studies. There is the dismissal by most regulatory agencies in this country of low-dose studies, even though the EPA has acknowledged that, quote, there may be some recognition of developmental concerns, but that has not changed any of the regulatory parameters. As a result, where changes have taken place, they've taken place almost exclusively at the level of market changes, or at least pushed by market changes, then leading states to make some changes. And in the one case of BPA being banned in baby cups and baby bottles, it was because we had reached the tipping point of so many states already getting to the point of, at the local level, banning. Just very quickly, I want to be able to. I do not have the magic finger, and I'm going to. There we go. Okay, and now I've gone too fast. Sorry. So some of the scientific issues, that BPA is an endocrine disruptor, and this is really critical, that there have been arguments and disagreements in the scientific literature. Even though we know that BPA exerts many of its effects through the estrogen receptor, we also know that it exerts its effects through many other different pathways. And by the estrogen receptor, I mean this kind of a lock and key mechanism here, where the hormone comes in, it binds to a receptor, so this is the lock to the key to the lock, and then comes in and causes changes within the cell. And most of the conversation has been in the scientific domain on whether or not BPA alters the estrogen receptor pathway at environmentally appropriate and physiologically significant levels. And I promise you this is almost done. And so there are many controversies about whether or not even these changes take place at important levels. Most of the controversy is dependent on what your species is and what the kind of experimental parameters, and we can talk about that if you want. But what I want to just leave you with is an argument that what we should be doing is taking a public health approach, both in our regulatory system and in our science system. We should start by acknowledging that BPA and other endocrine disruptors are associated with a number of negative clinical impacts. And that's where we should start. And then we should regulate using a precautionary approach, saying we should be worried about this chemical and we should do what we can do to decrease our exposures. And then we should worry about getting all the mechanisms exactly perfectly right. So with that, I think I'll stop. And I apologize for my inability. Okay, sorry, Frank.
So we know there's some technical issues here. Just a moment.
So you have to be patient when you get the...
Oh, patient, yeah. Get the arrow to work. So I'm going to take a slightly different tact here with talking about endocrine disruptors and move over to the thyroid system and talk a little bit about thyroid and breast cancer. First of all, for context, there are more than 87,000 chemicals in use worldwide today. Thinking about regulating all of those, testing those alone and in combination is a daunting task. So we have to find different ways to streamline these processes. And we're looking for developing different laboratory-based studies so we can, in fact, streamline these. But in a sense, the good news out of all of these components here, there's really only a subset of those that disrupt the endocrine system and are referred to then as endocrine disrupting chemicals, as Janet had mentioned. The endocrine disruptors, Janet already described, but it's basically any substance that will disrupt the hormonal system. It could either act like a hormone, or it can, in fact, interfere with the synthesis, the transport, and particularly the actions of the hormones at the cellular level. So they can include things like perchlorate, by the way, in your drinking water, which will interfere with thyroid hormones, or something leaching from your plastic water bottles, or the pesticides that may still be in the ground, even though they've been banned. So some examples of that include perchlorate, which are in fuels and propellants. Janet mentioned BPA, and I'll use that as the example in some of our studies. Plastics and polycarbonates. We think about them in the plastic water bottles, but they're also in the lining of food cans. And that shiny paper that you get from a receipt from a restaurant, that's coated with BPA as well. So you can get it by absorption as well as by direct consumption. Derivative of BPA, flame retardants. As you see in sort of the baby clothes where you have them treated so they're flame retardant, or things that you might put on a couch. That's another whole story of how we got those, but those are also, oh wow, I have the opposite effect of what you have. Okay, we've now caught up. Speed it up. Detergents, oxyphenols. We can also do a song and dance afterwards if we need to, no problem. Phthalates, and Tom Ahern will be talking about phthalates later on today. Pesticides and breakdown products. We also, in our laboratory, look at pesticides such as DDE, a breakdown product of DDT, and you say, well, why would you do that? It was banned in the 1950s. Well, these kinds of chemicals are persistent in the soil, so we're still absorbing these in different food products. So it's relevant to take a look at them, not only to figure out regulation, what we should be doing about controlling the exposure, but how to get rid of them. So there are lots of reasons why to study some of these compounds. And of course, we tend to skip up and over the synthetic estrogens. The key issues that we have to keep in mind when we're doing these kinds of scientific-based studies, as Janet was alluding to, is in part age of exposure is absolutely critical. The most vulnerable period of time is during prenatal development, and that's when all of our set points are being established, our neurological systems and our growth patterns are being established. So you can have a critical window where you might get exposed to a very low concentration or low dose of an environmental toxin or an endocrine disruptor, and you won't see effects until later in life when you get, if you will, a second challenge. You're exposed to a carcinogen and you're actually much more susceptible with an exposure early in life, changing your set points. And there's some amazing studies that have now shown that in human models as well. The time latency from exposure sometimes takes a long time. So as Janet was talking about, you're looking at these linear dose response curves. Well, that's great if you're looking within a month or less than a year. But in many cases, you're actually looking for an increased sensitivity to a carcinogenic exposure. So you're not going to see this for months or to years later. Dose response, I won't go over again because you showed those beautiful nonlinear dose response curves. One of the things that we really need to keep in mind that we certainly learned from the DES story is that these are transgenerational effects. And part of that is how these environmental endocrine disruptors have changed our genetic makeup, if you will, that gets inherited generation to generation. But of course, the biggest problem that we have is, as Janet was mentioning, is that we're exposed on a chronic daily basis to a mixture of chemicals, and it's very, very difficult to get through that process. So I just wanted to take a few moments, literally just a few moments, to talk about the system that we look at, and that's the thyroid system. And the reason that we look at it, it's very much a women's health issue. It is this thyroid hormones are essential for normal brain development. If you don't have the appropriate levels during pregnancy, women need to be euthyroid during pregnancy. The first trimester is absolutely critical for having the right amount of thyroid hormones delivered to the fetus. The fetus does not make thyroid hormones during the first trimester. So anything that interferes with thyroid hormone action could have profound effects on that developing fetus. Without thyroid hormones, you have neurological disruption, mental retardation, and somatic impairment, somatic growth impairment, as well as bone growth impairment. As we get a little bit older, it's critical to have appropriate thyroid hormones for sexual maturation, for maintenance of pregnancy, and also for metabolic issues as well. We've actually found now that thyroid hormones may be critical for a number of different types of cancer. And as Janet was mentioning, thyroid hormones, very much like estrogen, actually work through a recognition molecule, a receptor, that will regulate gene expression. And it's this receptor protein molecule that has been often found to be mutated in different cancers, including breast cancer as well as thyroid cancer. And so now the thinking is that the thyroid hormone receptor may actually function as a tumor suppressor. So interference with that can lead to an acceleration of cancer. And I just wanted to mention that the CDC has done quite a few studies, but they also had looked at maternal BPA during pregnancy, and that was actually correlated with a loss of thyroid hormones, a decrease in TSH, and an increase in T4 in males, but not in females. So we're just beginning to unravel these effects. So clearly, BPA can have an effect on thyroid homeostasis. One of the reasons that I think it's important to be considering thyroid disease is, as you can see in this upper graph here, thyroid disease is on the increase. And this is actually data on congenital hypothyroidism from New York State. And so this is the early 2000s here. That's a pretty dramatic increase. Thyroid cancer, which we look at, is also dramatically increasing at a rate of 3 to 5% per year, with a doubling over the last 10 to 20 years. So it's the fastest growing cancer. Just in our laboratory, we take a look at endocrine disruption of the whole thyroid system, looking at whether brain function and also directly at the level of the thyroid right here, and looking at tumorigenesis. And endocrine disruptors can impact it throughout this entire system. There are a lot of chemicals in the environment with estrogenic activity, such as the DES, DDT, and BPA. And interestingly enough, BPA can have the same effects disrupting the estrogen system as it does the thyroid system. So again, a lot of these structures are very, very similar, so they could act like the naturally occurring hormones or get in there and act like an anti-thyroid hormone or an anti-estrogen and get in and block actions as well. I won't go through this since Janet actually just described the exact same thing. And I'll just tell you that we are looking at the effects of, in one example, acute and chronic exposure to BPA in a cell system. And we use human thyroid cells. So what are we able to tell if we just give a short, low-dose exposure? What happens if we give a long exposure to BPA? And then what happens when we take it away? And can we look at changes at the molecular level to say, can we begin to look for biomarkers that would help us understand what's going on, that we could then take it to serum sampling and do epidemiological studies. So we're at the human cell level in order to be able to identify markers that we can take to the clinical studies. So we might look at thyroid cell characteristics, normal cells converted into more malignant cells, or do they move faster, are they more aggressive, and what are the pathways that are involved. Thyroid cancer incidence is important because it is, again, a women's disease. The data that we've just finished collecting for the state of Vermont shows that the rate of increase in thyroid cancer in Vermont is at least as high as the national average, if not a little bit higher. And it's actually, in Vermont, it's actually higher. It's 4 to 1 women to men. And we're just beginning to unravel some of those. It is the most common endocrine cancer. And a lot of the argument around, well, is there really an increase in thyroid cancer, has to do with the fact that we have better detection systems. So if you look for something, you're going to find it. You find small microcarcinomas, do they actually mean anything? But if that were the case, then we would have already plateaued at this point, and we would have also seen a plateau or a decline in mortality, because we're detecting it earlier, so we should see better improvement. And neither of that is the case. So there's been a lot of controversy, but it's quite clear now that most scientists and clinicians have accepted that there are environmental factors that are contributing to this as well. This is a one-slide summary of things that we do in the lab. And we look at gene expression. We look at the different types of thyroid cancer from the most common to the most aggressive. We look at pathways that are involved. And we looked at the effects of these endocrine disruptors with the idea that we can either take a tissue biopsy sample or a serum sample to begin to look at some of the changes that would be early indicators of not only thyroid tumorigenesis, but also the possible markers for exposure. And all of these are correlated with changes in cellular pathways. This is just to give you an idea that it can be fun looking in the lab to see what kinds of changes may occur. These are little cells. Actually, my daughter did these experiments for her high school project. And basically, if we look at benign cells, you don't see them moving very much. Follicular cells, they move. And very strong anaplastic or advanced thyroid cancer move a lot. And interestingly, as Janet pointed out, when we look at low dose to high dose, in normal cells, you see an increase in the cells that are ability to move. And malignant cells actually have the opposite effect in terms of the effect. They're more sensitized. So lower doses give a more profound effect. Just one example of what does it mean to look at changes at the genetic level or the molecular level. We looked at small RNAs, ones that control protein synthesis. And they're really important for development and cell proliferation, and they're important for stress response. All I wanted you to take away from this is not memorizing this entire list. But as I mentioned, we have benign, these are human thyroid cells derived from human tissues, acute exposure, low dose, high dose, a long-term exposure, and what happens when we remove it. So you can sit anywhere in this room and see chronic exposure, you've got more changes that have occurred compared to normal. And when you take away the BPA, it does not revert back to normal. When we look at malignant cells, it's almost as if they are primed. So that a chronic exposure to BPA results in a lot of changes compared to normal. And many of these changes are actually associated with a loss of our little favorite thyroid hormone receptor, the tumor suppressor, and an increase in factors that may be tumor promoters. So we're beginning to unravel that. So basically, we can see changes at the cellular level that are markers of tumorigenesis, and that these are directly involved in cancer, basically progression. So we're going to be looking at these to see whether or not they can, in fact, be used in a clinical study. And I just wanted to end with a couple of examples of BPA related to breast cancer. There is a lot of evidence that indicates that BPA exposure can be directly impacting the development of mammary tissue in animal models and breast tissue in humans that is aberrant. And this has been going on since the mid-2000s at least, with cell studies looking at human breast cancer cell lines, markers of tumorigenesis at low concentrations, at not high concentrations that are causing these changes, and changes in the mammary tissue with increase in density. And I just wanted to share some studies from non-human primates. These are rhesus monkeys, and this is from Anna Soto's group in Boston, and found that estrogens in the wrong place at the wrong time, again, it's the fetal exposure to BPA, results in an increase in density in the mammary tissue of these rhesus monkeys. And the concentrations that they were used were comparable to what humans would be exposed to now. So these are more and more cumulative evidence of not only what happens with the exposure to BPA, but it's at levels that we are constantly exposed to in the environment. BPA does impact prostate cancer, uterine cancer, and ovarian cancer. And there are a lot of studies now that have shown that the molecular changes that are associated with it in animal studies, they've moved from cell studies to animal studies, and in particularly prostate cancer by Gail Prinz out in Chicago has now shown that in human tissues as well. So it's a direct correlation with fetal or neonatal exposure to BPA resulting in cancer development. And as we know, cancer development is complex. It takes years, and we're trying to understand the interaction of many, many different chemicals on the complexity of the cellular responses. So it gives us a little bit of difficulty when we take this kind of data and move to the regulatory level, as Janet was explaining. So now we're stopped. We're stopped. You've demonstrated that this can stop, so I guess I'll stop there. I only had one more slide, which was showing the next generation. So thank you very much, and I think we might have a few moments here for some questions for all of us on the panel. Thank you. Go ahead.
I have a question. You presented in all three of the presentations that this is prevalent in 95% of the population right here. I'm curious to know, where does OSHA fit in this, and what happens to people who really are exposed to extreme high concentrations in a manufacturing setting, where you may have women who may have a much higher reservoir of this chemical in their system? And have those studies been done, and what does it mean?
So, excellent question. There's actually just been a year and a half ago, the first real occupational study of women exposed to high levels of BPA by Jim Brophy and colleagues in Windsor, Canada. Women in the auto workers industry. So unfortunately, most occupational studies are fairly old, don't look at single chemicals, and don't include women. So what's wonderful about Brophy's study is that it's a very recent study. It looked at a number of factors, including prior working in agriculture, which is the second big industry in the area, found increases in breast cancer incidence in women with high levels of, or high exposures through working in industry that were then further increased in interaction with prior experience in agriculture. So this is really the first occupational study of that sort. There's also a study from China looking at high dose exposures in male workers, and length of exposure and actual blood content of BPA is associated with decreases in fertility, sperm motility, and sexual function more broadly. In terms of OSHA, OSHA is not at this point at all involved. We've been having conversations with both NIOSH and OSHA and trying to begin those conversations, working also with unions to try to begin to educate people about these complexities, but this is really the beginning of those conversations.
I'll add a little quick postscript that, as you might imagine, some of the common industries for women, like nail salons, that are pretty unregulated and often poorly paid and not unionized, and
Right.
sometimes employ immigrant labor, et cetera, are some of the highest exposures. If you walk into a salon or a dry cleaning place and you have a strong smell, you're smelling these endocrine disrupting chemicals. The novel was My Year of Meats by Ruth Ozeki, but actually a fantastic book that Janet covers a lot of what Janet and also Fran have talked about is It Safe?
Yep.
By Sarah Vogel. And that just came out in 2013. Is It Safe? And it's a whole regulatory and scientific history of BPA.
It's a story of BPA.
It's very, very well done and very well researched. Is It Safe? And the first book is a novel called My Year of Meats, M-E-A-T-S. It's a study by Ruth Ozeki, O-Z-E-K-I, and it's a story of a filmmaker working for a Japanese film company to prepare weekly segments for Japanese housewives on how to cook beef. And in the course of doing these segments, she gets more and more radicalized.
What was the name?
My Year of Meats.
And if anybody, as you're leaving, would like just the resources for the campaign, the Think Dirty app, and the Skin Deep database, I have the websites here.
Should we thank
Okay,
everybody?
great. Thank you very much.
Thank you, everyone.